Welcome to BHRUT Maternity Services, where we care for over 8,000 women a year. Now we'll take you through to the maternity unit tour.
Once you find out that you're pregnant, it is really important that you complete a referral to our maternity unit as soon as possible, ideally before 9 weeks of pregnancy. You can do this by completing a self-referral form online or through your GP.
Here we are at Queen's Hospital in Romford, where we provide antenatal, labour and postnatal care. To access our maternity services at Queen's Hospital, you can enter through the main entrance.
Take either the escalator, stairs or lift up to the first floor. Follow the corridor around to the first junction. You'll find the antenatal clinic, scan department, obstetric assessment unit and fetal medicine unit in the orange zone to your left. The antenatal clinic is towards the end of the first orange corridor. You may come to the antenatal clinic for specialist midwife appointments or to see a consultant obstetrician or a doctor in the team. This corridor is also home to the fetal medicine unit, scan department and obstetric assessment unit, which can all be found when you enter through this door. You may be asked to come to Queen's Hospital or King George's Hospital for your scans throughout your pregnancy, depending on where you live and the reason for your scans. At BHRUT, we have both male and female sonographers that work in our scan departments. You may come to fetal medicine if your baby needs extra monitoring by specialist obstetricians during your pregnancy.
The Obstetric Assessment Unit, also known as OAU, is open between the hours of 8 AM and 6 PM every day of the week. You may come here if you need regular monitoring of your blood pressure, a scan review, or if you're having an induction of labour or daily monitoring of your baby.
The antenatal ward, postnatal ward, labour ward, maternity triage, neonatal unit and the high dependency unit are all located along this corridor in the blue zone.
When you enter the hospital from the main entrance, this is located in the corridor to your right. The antenatal ward and the postnatal ward are both accessed through the same door.
The antenatal ward is an inpatient ward, which means often people have to stay here overnight. The antenatal ward is made up of 16 beds. You might come to antenatal ward if you're coming for an induction of labour or if you're in early labour.
Postnatal ward is made up of 22 beds. You may come onto the postnatal ward after you have given birth if you have had an epidural or a C-section or baby requires some extra observations. Usually, you will stay in the postnatal ward until you are ready to be discharged home.
This is maternity triage, which is the equivalent of accident and emergency for women above 20 weeks of pregnancy. We are open for 24 hours a day, 7 days a week. You may come to maternity triage if your baby's pattern of movements has changed or if baby is moving less. If you have any vaginal bleeding, if your waters break, if you are feeling unwell, if you have any severe headaches with visual disturbances, if you have constant itching, especially on the palms of your hands and the soles of your feet, if you have severe abdominal pain, or if you have any signs that your labour has started. If you are unsure if you should come into triage, go to A&E or see your GP or local pharmacist. You can call the maternity helpline where a midwife will advise you on the most appropriate place to go.
So labour ward is one of the 4 options where you can birth at BHRUT. It is a doctor-led unit where obstetric team will have an oversight and input into your labour care. You may come to labour ward if you have any medical conditions or if you have developed any pregnancy-related conditions such as high blood pressure. You may also come to labour ward to give birth if you wish to have an epidural. There are 15 rooms on the labour ward, including a room with a pool. Each room has its own ensuite bathroom. Labour ward also has a snowdrop suite for families whose babies have sadly passed away before, during or immediately after labour.
Through the labour ward, you can access the maternity theatres. You may come to theatre to give birth if you are having a planned or emergency caesarean section. You may also come to theatres after your baby is born. Some of the reasons you may need to come to theatre after your baby is born is if you need some assistance with delivering your placenta or if you have an extensive perineal tear. Sometimes, if you are unwell, you may require one-to-one care in our maternity high dependency unit, a 6-bedded ward where you can be monitored closely. The blue corridor also gives you access to the neonatal unit. Your baby may come to the neonatal unit if they are born before 37 weeks or if they need any medical care and specialist support from the baby doctors. Our second postnatal ward, Coral Ward, is in the orange zone on the first floor. You may come to Coral Ward after baby is born if you and baby do not require any extra medical care or observations. If you come to Coral Ward after you have given birth, you will be discharged home from here. Queen's Birth Centre is located on the third floor of the hospital. This can be accessed via the blue lifts. The birth centre is home to 7 birthing rooms, 2 of which have a built-in pool. The rest have access to blow-up pools. The birth centre at Queen's Hospital can be used by women who would like to give birth in a home-from-home environment. As the birth centre does not have any doctors physically present on the ward, if you have any medical complications, you may be advised that the birth centre is not the safest place for you to give birth. You will have this discussion with your midwife or obstetrician during your pregnancy, or with the midwives and doctors in triage. Unfortunately, sometimes, even if you have planned to give birth on the birth centre during your pregnancy, due to the activity in the maternity unit, this may not be possible. You will then be cared for on the labour ward by midwives. This is King George's Hospital Maternity Department. There are no labour or emergency maternity facilities at King George's Hospital. The maternity department here consists of an antenatal clinic, a maternity scan department and a phlebotomy service where they do blood tests. You may come here to see a specialist midwife or an obstetric consultant during your pregnancy. For most of your antenatal and postnatal midwife appointments, you will see the midwife at a clinic in the community. In addition to the birth centre, labour ward and maternity theatres, you also have the option of giving birth at home. If you wish to have a home birth, please discuss this with your community midwife who will be able to support you through this decision.